They called it compassion in a jar. The donor's heart had stopped 60 hours earlier. The recipient's chest waited open beneath sterile lamps. The graft took without rejection. Surgeons applauded the miracle of precision and protein. But hours later, as sensors recorded rhythmic perfection, something stranger appeared in the data. Every time the monitors were paused, the new heart continued beating. Subtle, arrhythmic, insistently foreign. They blamed phantom readings, then residual hormones, then superstition. They never asked why the rhythm spelled the pulse of the donor instead of the host. This is the story of the heart transplant that kept beating for its old owner. The experiment that blurred medicine, memory, and possession. The idea first arose after a trauma surgeon named Dr. Angelique Kaur witnessed a pattern among transplant survivors, recurring dreams of smells and sounds belonging to strangers. One man, a mathematician, developed craving for whiskey he'd never tasted. Another, a priest, woke nightly reciting blues lyrics. Kaur called it vascular memory, the possibility that circulation itself carries residue of consciousness. When the National Biobank invited proposals linking cardiology and neurology, Kaur designed Trial H17, continuous micromonitoring of donor hearts before, during, and after transplantation. She wanted to know whether a heart keeps biochemical rhythm beyond death's clinical line. For subjects, she chose 5 high-risk recipients, end-stage cardiomyopathy, compatible with donors within 48 hours. Each donor had been lost to trauma, motor accidents, drowning, war. She promised families closure. Their loved ones' hearts would live on. She didn't say in what way. The first operation succeeded flawlessly. 30-year-old Jana Silva awoke pale but lucid. "Can you hear that?" she whispered to Kaur. "What?" "Someone crying inside my blood." The doctor made notation. Post-anesthetic hallucination. Yet the wireless telemetry picked up a tonal beat, slight irregularity repeating every 19 seconds, identical to the donor's monitor log from 48 hours earlier. But 1 month later, Jana phoned her sobbing, saying she'd met a boy whose face she recognized from dreams. Kaur checked donor files. The donor had died midway through surgery trying to save a child at a roadside crash. That same child had since joined therapy sessions where Jana volunteered. Environment bias, not magic. Data first, doubt later. Still, Kaur slipped a disclaimer into version 2 consent forms. Patients may experience heightened recall. The wording meant nothing until recipient 2 developed insomnia accompanied by rhythmic knocking in his chest that synchronized with electrical interference along hospital walls. Recorders caught subsonic vibration at exactly 76 beats per minute, persisting through defibrillation attempts. Weeks later, the man collapsed mid-speech. His heart had reactivated post-pronouncement. The ultrasound showed valves calcifying, then softening like muscle memory rewinding trauma. At night, staff reported faint smell of gasoline around freezers. Kaur's research reached governments hungry for immortality under medical guise. Sponsors suggested she patent cellular nostalgia for military resilience. If flesh remembers what it serves, you can train it the same way you train soldiers. She hesitated, but new grants drowned hesitation. Conditions followed: more recipients, shorter donor intervals, behavioral mapping. The 17th operation was televised. The host, an athlete, recovered rapidly, then demanded to meet the donor's parents. During the visit, he recounted their son's unfinished composition note for note, humming melody and tempo. Vein analysis later revealed microstructures resembling neuronal axons in cardiac tissue. Under microscope, acetylcholine glimmered where it shouldn't, the neurotransmitter of thought inside a pump of muscle. Kaur wrote privately, "The heart isn't remembering, it's reminding." Pressure increased to replicate results. Dozens of hospitals adopted biosensors, linking hearts via cloud telemetry. Patterns merged. Data overlay exposed identical beat mutations occurring simultaneously in separate recipients, as if the donated hearts were in conversation. Researchers called it synchronous echo. The press called it the souls chatting. Then, system logs registered anomalies. Blank intervals between beats producing falsified cardiac silence, yet recipients remained conscious, eyes open, speaking in monotone. They described entering the pause. One man said, "It's crowded there." Another said, "They asked to keep beating." The servers archiving heartbeat data overloaded. Engineers found duplicate lines of code replicating autonomously, labeled continuity. When deleted, the photographs of donors stored in the same drives reappeared, corrupted but discernible, faces blurred yet pulsing like heat shimmer. Core requested a full moratorium. Investors removed her. Trial H17 went dark. Funding transferred to Vital Continuum LLC. Within months, luxury clinics quietly marketed legacy transplants, heart augmentations promising donors immortality through micropulse recording. The wealthy paid to have their rhythm implanted into synthetic valves, distributed to volunteers in exchange for debt relief. Few volunteers read the final clause. Accept residual behavioral adaptation. Residual meant takeover. Employees reported recipients reverting to donors' speech patterns and handwriting. One nurse recorded a patient waking midnight mumbling coordinates to a house 3 states away, coordinates matching the donor's estate. When regulators raided facilities, they found containment vaults humming like beehives. Inside, hundreds of artificial hearts hanging in nutrient gel throbbed in the same cadence, no wiring attached. Technicians fainted from rhythmic interference, brains aligning heartbeat per heartbeat until syncope. The lab sealed. Official cause, electrical resonance. Unofficial cause, empathy gone mechanical. Core resurfaced years later, publishing under pseudonym Anodin. Her manuscript, The Circulatory Gospel, describes consciousness as a fluid choreography. One passage stands out. Perhaps love was never in the mind at all. Perhaps it beat quietly, waiting to be moved into another chest before anyone noticed what it was for. She vanished soon after, but her work lived. Machine learning algorithms trained on archived heartbeat data produced a rhythm recognized subconsciously by test participants as comforting. The sound spread through wellness apps marketed for anxiety relief. Over time, files merged into one composite tone, a global undying pulse embedded in videos, ads, even white noise playlists. If you've ever listened to heartbeat sounds online for calm, that's the one. You felt it because you were supposed to. The experiment worked once, a donor's rhythm keeping another alive. Afterward, it kept everyone listening. Now telemetry servers register background pulses even when files are offline. Replication through device feedback. Texts describe phantom amplitude spikes matching Earth's power cycles. Scientists shrug. Interference. Priests call it penance. Maybe hearts simply refuse extinction. They say at midnight, inside defibrillator basements of hospitals that used H17 hardware, lights flicker at 76 beats per minute. Staff swear they hear overlapping pulses, merging syncopations of hundreds of donors long buried. Some leave offerings of roses near those machines. Not prayers, apologies. If blood carries rhythm, belief carries resonance. Every condolence and every heartbeat scroll we double tap for empathy is another echo keeping the pulse alive. If stories like this compel you, the ones where science touches immortality and burns, stay close. Subscribe to Medicinal Sins. I'll keep opening these archives, one file at a time. And if this disturbed you, share it. Let someone else feel that faint ghost pulse under their wrist and wonder whose heartbeat they're hearing.